Really, the goal is just to use our stories to bring veterinary medicine to life for the pet caretakers of the world. And we're doing it because we believe that educating these caretakers is the most powerful thing that we can do to improve the life quality of all of the pets that we love. Hi, it's Dr. Natalie Keith.
Dr. Josiah Dame.
And this is Vet Tales. Good morning.
Good morning.
Or afternoon or evening, as I sometimes say.
Yes.
It's morning for us. We're going to talk about
the thyroid.
The thyroid.
And cats will get some discussion today.
Yeah, cats are going to be the highlight of the discussion, in fact. We're going to touch... Well, I think we should start with dogs.
It's just easier.
Because it's just easier.
Yeah. A lot easier.
Yeah, so dogs... And the dogs are going to be a little more comparable to human medicine.
Yeah.
As they tend to be hypothyroid, which is what, is more common in people.
Yep.
I don't know that there is really hyperthyroidism in dogs unless they...
I've had a couple, but they've all been cancer.
Yeah, like tumors. Yeah, for sure. Yeah.
Thyroid.
Yes, but extremely rare and...
Or iatrogenic, which is a fancy word to say we caused it.
Oh, yeah.
It happens.
Yes.
And so we can discuss that later.
Yeah, we can. Well, let's just... we can talk about how that happens or why it happened because of the process the pet was going down.
Exactly.
So hypothyroidism. These dogs are typically chubby, but a lot of dogs are chubby in normal thyroids. A lot of times they will have chronic recurrent skin infections, dry, flaky skin, itchy, getting hair loss. Yeah, that bilateral, so over both sides they'll have a symmetrical hair loss pattern over their kind of back / behind the ribs kind of. Naked tails, yeah. They'll get the tail, the top of their tail being naked. But a lot of times not abnormal skin underneath it. It'll be really, really healthy skin looking stuff and just no hairs growing there. Pattern baldness, essentially.
Yeah. Heat seeking, so they tend to be cold, so they'll be right on top of you, or they'll always want to be next to some kind of heat source because they're not regulating temperature very well. Yeah, and a lot of times they don't have a ton of energy.
Yes. So I feel like that's and that's relatable, I think, to people. They'll feel real, if their thyroid's low, they feel real sluggish and just sleepy, weak almost.
What demographic do we see?
The dogs?
Yeah.
They're going to be typically large breed dogs, typically middle to older age.
Yeah.
So, classic would be a golden retriever that's 7.
Yep. I think the labs often.
The labs, yeah, for sure. Boxers occasionally. I've had a couple of boxers over the years and some bulldogs. Gotta love the bulldogs.
But it could be anybody.
It could be. Yeah, it really can be. But so they, a lot of times owners will actually come in wondering if their pet's thyroid is low because their pet is chubby. That's usually the thing that brings up the question, can you check my dog's thyroid? Because he's fat.
Yeah. Sometimes I'll be like, let's start a diet, and then in 30 days, if we're still not losing weight, then we'll check the thyroid.
Especially if they have no other skin issues or hair loss or any other symptoms. I'm I think this may be diet.
Yeah, let's
lifestyle.
cut out treats, see what happens first.
It's so hard.
We'll run the thyroid. And it's interesting. So we have those dogs that are hairless, losing hair. I almost said depressed. They're not depressed. They're lethargic. They're moving slow. They are warm-seeking behaviors. And then we do the thyroid test, which the screening test is a total thyroid that we can do in-house.
Yeah.
And if it comes back abnormal, which would be less than 1, then we typically would recommend doing a free T4 to confirm hypothyroidism.
Yeah.
Though I do feel like there are some situations where it's super, super, super low on the total T4.
And the symptoms are
just But typically gold standard, we will be doing a free T4 following, which is warranted because I've had one that was a really, really chubby dog just 2 weeks ago who I was like, hey, let's do the free T4, less than 1. And then I was like, okay, let's send off the free T4, and I was like, this is slam dunk. I was hyping myself up. I was like, I caught this, and it came back normal. And I was like, well, good thing we didn't start treatment. So the free T4 is very important, and most of the time we do send that off.
Yeah.
The downside of the free T4 is it's freaking expensive.
It is, and I think that's why hypothyroidism is so wildly overdiagnosed, because for starters, the thyroid level in a dog is very cyclical. So at any point during the day, they could be normal and then low.
Yeah.
And so it could be normal for them to be low at a certain time. And that's why the free T4 is imperative, but it's so expensive to send out. How much did it cost here?
I think our cost, I think for us to send it out, it was $200.
Dadgum, yeah, that's a lot.
Or $230.
Yeah, it's so much.
It's really expensive.
But if you find that your dog's normal, then you didn't spend a ton of money on levothyroxine and thyroid rechecks.
Exactly. So I like to follow rules. I'm a rule follower. I like to do my free T4 after I get a low total thyroid. That is the process I like to follow, and the process I go with, and gold standard, whatever. Blah, blah,
absolutely.
Blah. But
because you can make these dogs hyperthyroid if you're treating them and they don't need to be treated.
Exactly, and you get there's something called euthyroid 6 syndrome. So you can just have a cyclical low dog, like that fat dog that I saw that one day, Chubby, who I ran that test on. It had a low total T4. I sent off the free T4. It was normal. There's also situations where you have something called euthyroid 6 syndrome, where your dog is sick from a different disease process, and the total T4 is falsely lowered.
Yeah.
And so that's another situation where sometimes I'll be like, okay, we're checking a thyroid, just check a thyroid, it's low. And I usually will tell people, I'm like, there's this other disease going on. I assume this is fake.
Yeah.
This is euthyroid.
Yeah.
Let's send off the free T4 to confirm, because we need to treat hypothyroidism if we have it.
Yeah, and there's the study that they did. They did a study on sick dogs with euthyroid 6 syndrome, where they supplemented the thyroid to bring it back into normal range while the pet was sick, and they actually stayed sicker longer.
Yeah.
So you can decrease the body's ability to fight infection by artificially increasing the thyroid level, because the body dropped it for a reason.
It's kind of like a fever.
Yeah,
It's like,
yeah.
they
It's
tell
like
you, this is a good fever, don't treat.
Yeah, exactly, because
so,
it helps support the immune system, because essentially dropping that thyroid is slowing down your metabolic rate, and therefore you're losing less energy during the process where you're devoting all energies towards fighting disease.
Yeah. Can you tell I have a 1-year-old? Good fevers.
This is a good fever.
Yeah.
There's just no such thing when you're a mom.
And I'm like, but he's miserable.
I know. I've never had a fever and been like, oh, this is good.
Is a good one. Let's not. I'm like... Yeah, but he's miserable. So
I'm like 98.7. I need some Tylenol. I can't. Anyway, okay. All right, okay. So that's basically thyroidism in dogs. What we do then essentially is put them on a supplement to, when we've confirmed that they are truly hypothyroid, we put them on a supplement, and then we monitor their thyroid level to make sure that that dose is what that dog needs. Some dogs need more or less, depending on the severity of their hypothyroidism, which can change over time. So it's important that we recheck those levels intermittently. But typically, we don't have to send out the expensive test for that. We just...
T4.
Yeah,
total
we just
T4.
do the total T4 at a specific time of day when we know kind of when the thyroid supplement's going to be at its peak, and get an idea of where this dog is sitting.
And it's the most annoying. Like, monitoring thyroid is annoying for the owner, I know, and for me.
Yeah.
And I usually say, I'm sorry.
Although all endocrine diseases, quite frankly, are annoying to monitor.
It's like turning on a shower, and you want to get, like, the perfect warmth of water, and then it's, like, too hot, too cold. And so we see you back quite a bit until we get it regulated well enough.
Yeah.
And then we go to the every 6 months from there.
Yeah.
And we'll obviously factor in, like, okay, clinically we're doing really, really well, even though this isn't the perfect number because we're not treating a number. We'll maybe potentially say we're controlled. Like, our symptoms are controlled, even though, this isn't the perfect range that I would like to be in. We're going to call it there and then recheck in 6 months.
Yeah, it was like that. I rechecked a dog for you. It was a black lab. I forget, maybe 8 years old.
Yes, and like hairless. When I first saw hairless, and large.
115.
And I walked in and
115
I said,
pound Labrador.
yeah, I think it had been seen for skin stuff a couple times, and I was like, I went, let's check thyroid. I don't think this is
I have
all
a
y'all
little
like.
hunchy hunch.
Yeah, I was like, I don't think y'all are feeding that many treats, because
Yeah.
he was like 115, 120, and I was like, oh my gosh, what I call a walking ottoman.
Yes, no doubt.
You could have a whole breakfast spread on the back.
Oh, yeah. Yes. And so then so we started him on the supplements after confirming his hypothyroidism, put him on the supplements, but they kept missing their appointments to recheck his thyroid. God love him, I get it. And so we just kept refilling it, and then eventually we're like, no, like we've got to recheck this. So we have not actually rechecked him, but he's been on, because that's coming up in 2 weeks, because when he came in for his recheck, they had run out of medicine a week prior.
You have to be on the pills.
If you're not on the pills, I can't tell you if the pill is working. And so essentially we refilled it again. They're going to come in 2 weeks, but in that 3-month period of this whole situation going on, the dog has regrown his hair and lost 15 pounds.
It's been like a month.
And they changed nothing else except for giving him this pill. Sometimes.
Yeah. And those are my favorite rooms when I walk back
great.
in. And I'm
So
like,
rewarding.
Let's send out the free T4, but guess what?
Yeah. And so I had another one recently. She's a patient that we've had since she was a young one, and all of a sudden she's probably 6, 7 now. All of a sudden starts losing her hair like crazy and is dry and flaky and so forth. She did not gain any weight, but had this dry, flaky, weird coat, brittle, and I was like, I think it might be hypothyroid. And sure enough, she was. We put her on the supplement, and she is almost completely back to normal now.
Awesome.
So I didn't send out the free T4 because the owner was like, meow. And I was like, okay, well, let's just try it.
Yeah.
And so
That happens.
and that's okay. Like, this goes back to the podcast we had last time. Like, sometimes it's like $200 is nothing I can do. And so you monitor response to treatment. So not gold standard, but certainly manageable, and in this particular case was still very effective.
Yeah. And then another tale is me and Dr. Estep both kind of have tag teamed this, but we had a patient come back for their recheck, and it had started to drop hair and lose weight.
Oh, yeah.
And so...
Because a different doctor had initially seen that pet, and it came in it was either you or Dr. Estep first.
Dr. Estep saw it first, and Dr. Estep reran a total T4, and we were hyperthyroid. So that's what we call iatrogenic hyperthyroidism, meaning it was caused by accident through the medication. So the dose, though it may have been great when we first started, was too much later on.
Yeah, as a pet loses weight, or as its thyroid starts to kind of wake back up, or whatever the case is. Because that dog's thyroid hadn't been rechecked for a long time. I don't remember what the record said.
Yeah,
but.
And she was hairless, and she was losing weight, and she looked like a hyperthyroid cat almost.
Yeah.
This dog. So for them, we had to recheck often, because we had to not only, we stepped back on the dose a lot, and then we were too low, and then we had to slowly kind of make our way back
up to normal.
an appropriate dose.
Which is how you have to deal with if you accidentally overdo your insulin dose in diabetics, it's the same process. You have to go back to baseline and work your way back up.
Yep.
So fun for everybody. Anyway, yeah, that's hypothyroidism in dogs. I feel like this is a good segue into cats.
Yeah, 100%.
Yeah.
So cats are going to be hyperthyroid. So typically on presentation, people will be like, we're just a ravenous eater. We our coat doesn't look great anymore. It's not shiny. We kind of look like a Muppet.
Yeah. Yeah, with the little triangulated hair patches.
Yeah. And just not thrifty. And then just eating ravenously, losing weight, or
the weight loss is a big one. And they always think it's diabetes.
My favorite presentation is always, we vomit like once a week. And I'm like, okay, if you're above the age of, any cat, I'm going to be like, let's also check a thyroid. Because that, infrequent vomiter, we got to check the thyroid.
Especially when they're a good eater and losing weight. That's classic.
Yeah. And so we'll do full lab work, so a CBC comprehensive, and then on that comprehensive, sometimes you see a mild elevation of liver values, which is another cue in to maybe we're hyperthyroid, and then you run your total T4, and it's above 4.
Sometimes 20.
Yeah. my brother's cat was like 20,
Yeah.
above 20.
Mm-hmm.
It was greater than 20 and didn't read. And so at that point, you go, all right, we got a diagnosis.
Yep.
And then we start our pill, which,
Or
there's a couple things you can do.
so many.
You can, which that's evidence of like, what's the best way?
Yeah, when there's so many
When there's
options.
so many treatment options. So there's a pill called methimazole. There's also a topical administration called methimazole, which you would put on the ear through one of our pharmacies. You can do radiation therapy of the thyroid. You could do a diet change, which I feel like is not commonly used.
It's really effective if the cat likes it and if it cannot get access to any other food.
Mm-hmm.
So I typically only see owners go for the iodide restrictive diet if they have no other pets in the house.
Mm-hmm. Yeah.
Or just small children.
Yeah.
Mm-hmm.
Definitely. And
But it does work.
Yeah, and then it's on our list, but surgery.
Yeah, great idea. Yeah, just go cut that thyroid out.
Yeah. So those are technically some treatment options. I feel like the most common that people go with is methimazole, which is the pill and or the transdermal, so on the ear. Second most common, and they did do it at OSU, I'm not sure if they do it anymore, Oklahoma State, is the radiation therapy. It's wild.
Yeah.
Did you do it in school?
We did, yeah. Yeah, the cats would go get their it's an injection of.
I'm laughing because we're about to reveal why. To me, it's crazy.
It is, yeah. And then you have to put them in this chamber to prevent a radiation exposure to the nearby humans and or other animals for 72 hours or something. I forget now. It's been so long.
I think at OSU, they boarded them for weeks.
It wasn't weeks. It was days.
It was days? Okay.
But it might have been all week. I don't know. Maybe it was 7 days.
Yeah, long story short, they become radioactive.
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 Yeah.
We're going to hit copper street.
Yeah. Yeah, I'm sure.
But yeah, after they get treatment, they do the radiation therapy and then they're radioactive. So their urine is radioactive. And so at OSU, they would keep them until they were no longer radioactive. When I was in Dallas, don't quote me on this, but there was a couple that I think did it, and they did send them home pretty quickly after. And I think they were these are the precautions you have to take. Blah blah blah. Blah.
Yeah. It's and you have to have special equipment, special locations, special permits, special, and it's expensive.
It's expensive, and on top of it all, there's always the chance that you'll have to
repeat it.
And
especially if it's a younger cat that's getting hyperthyroidism, 7, 8 years old. You can pretty much bank on you're gonna have to do it.
And they have to have no comorbidities or very mild kidney disease on top of it. So if they have a higher level of kidney disease, they're not a candidate.
Yeah, so I would say probably 95% end up on either the oral or the topical methimazole.
Which one do you prefer?
So
for treatment, not necessarily for ease.
Yeah, so I guess I don't.
It's cat to cat.
Yeah, it is cat to cat. So my tail, I had a hyperthyroid cat. And he was probably about 10 or so when we diagnosed him. And I put him on the oral methimazole. And he's such a good boy. He would eat his little pill out of in a little chunk of treat, and squish around there. And he just gobble it right up. And it was great. And I recheck him 2 weeks later. And I was like, that's not better. And so I increased his dose. And I waited a couple weeks. And I rechecked him. I was like, that's not better. And so I put him on the whopping dose. And I was like, it's still not better. And so I put him on the transdermal, and he responded immediately. So for whatever reason, he was not absorbing and processing that. He didn't have any GI symptoms or anything.
Yeah.
Now, other cats will get a topical localized irritation from the cream, and so you can't use that with them. Or you have small children in the house, and you're nervous that they're going to I don't know, lick the cat ear or whatever. So there's, reasons why you, good pill takers. I have one client that her cat has been on the pill version of methimazole forever and has done really, really well and is a good pill taker, and owner has no trouble giving it. But then she developed IBD as she's aged, among other diseases. And so we've just recently switched to the topical for that reason. And so I guess it just depends.
Yeah, totally. I think so too. I usually start with a pill. and see how they respond to it.
And if the owner can give it.
If the owner can give it. So I'm usually like, try this.
It's
and then
cheaper
if it's not working,
to do the pill.
Then we'll go to the clicker.
Yeah, and the clicker, as you say, it's compounded, so you really got to try the pill first, legally.
Yeah.
Because we have to use drugs that are labeled for and commercially available before we're allowed to use compounded medications. So usually, and we don't keep the cream in stock, so you're having, it's like a week before they can get it shipped from the compounded pharmacy, so usually you're trying the pill for a little bit, and then if the owner likes it, great, and if not, you go ahead and put through the order for the topical.
Yeah, shockingly, most people don't have a problem. And that might be because the cats are hyperthyroid, so they're just like wanting to eat everything. So you just drop it in a little bit of treat, and they
that's
they
right.
eat it right up. But then as you get them regulated, sometimes they're like, they're not taking the pill anymore, and then you're like, okay, we can talk about maybe transdermal.
Yep. So we start them on their medicine. Now what?
Now we have our baseline lab work. We start them on their medicine. We recheck lab work 2 to 4 weeks. And we're going to check a total T4 again and see if we've brought down that thyroid level, increase dose if needed. And I am a proponent for checking for their kidney values again too.
Same.
Because as you treat, and we always harp this when we diagnose them, as you treat hyperthyroidism, you are going to be lowering their blood pressure. And
which is a good thing.
Which is a good thing. But there might have been kidney disease there that wasn't showing up on the lab work because they had great blood flow to their kidneys.
It was just squishing it all along through there.
Yeah, and damaging the kidneys because high blood pressure damages your kidneys. And then as you treat, you start to unmask kidney disease. Yeah,
I think it's really important to just circle back over what you said in the sense that we are not creating renal disease by dropping the blood pressure, but rather we are revealing or unmasking the kidney disease that was already there. It's very common to have those two things together, especially because they're commonly found in old cats.
Yep.
So
exactly.
So what's I don't know if you do anything else in regards to this, but I also check BNPs. Which is it's a snap test we do in-house. You can send it out to a lab for quantitative analysis, but it essentially is measuring a stress protein or stretch protein that's released by the heart whenever the heart is in a state of disease or it has been stretched past its normal capacity. Because, again, as we mentioned, we've got a ton of high blood pressure in these hyperthyroid cats. So one of the most common comorbidities for hyperthyroid cats is a disease called hypertrophic cardiomyopathy, meaning that the heart muscle has become very, very thick in an abnormal state of thickness, which then further exacerbates the issue because then as that heart muscle gets thick, the lumen, which is the middle part of the heart that holds the blood, is becoming smaller and smaller. And so it cannot pump as much blood because it can't hold as much blood per time, so it has to pump double fast in order to move the same amount of blood. And so you've got this kind of like snowball effect of heart disease that happens, and then these cats are actually really prone. That's actually what ended up causing the demise of my cat was his, even though he had his thyroid well regulated, he eventually developed hypertrophic cardiomyopathy. Which,
and you can catch murmurs on them too.
Yeah, and this
sometimes
is a whole nother topic in general, but you can have heart disease with no murmur, or you could have a murmur with no heart disease in cats. It's very infuriating, which is why I love the BNP for screening, because if it's normal, it's probably normal. If it's abnormal, you need to check to see if there's truly heart disease present. So a lot of my cats will go on heart medication and the thyroid medication at the same time.
Yeah.
Which the heart medicine can help with kidneys too. So.
Yeah, definitely, because it's going to be like an ACE inhibitor.
Yep, exactly. And so it's designed to kind of manage both problems at once, which is always handy when you have multiple problems.
And then, little like thing I mentioned to people when I diagnose them, the cats who are clinical, I'm like, they're not going to just magically, as soon as you start the pill, stop vomiting, start feeling completely better.
It does take some time.
It takes some time. Sometimes they need to be hospitalized for a couple days. Sometimes they just need anti-nausea for a week. And so supportive care is needed. And you don't get out of the woods immediately. when it comes to that. Definitely if they're like really in a bad way from their thyroid disease.
And it's probably also worth saying, like, this is lifelong. Like, you're going to manage this for the rest of the cat's life, with the, potential exception of the radiation, which still can still come back. This is something you just deal with, and they feel so much better. They'll immediately go back to not immediately, as you say, but within a month we're grooming again. We're gaining our weight back. I find hyperthyroid cats walk around a bit like they're achy, like they're on eggshells, and they'll start moving better and jumping up and doing things again. And so you can really improve their quality of life very quickly and effectively, but it is lifelong management.
Definitely.
But so worth it. They can go on that thyroid medication. I mean, my cat, I think, was hyperthyroid for 4 years or so, and he's probably close to 14 when he died. So
it's always funny to me sometimes when they're like the hyperactive hyperthyroid cats that are like really vocal and like
keeping everybody up at night.
Everyone up at night, but also like they have a lot of personality when they're hyperthyroid too. I've had people be like, he's so chill now. Like,
he just sleeps all the time.
He just sleeps all the time. I'm like, yeah,
we have resumed normal cat status.
Yeah.
Yes.
I'm like, you don't want that.
They're just like, they're back. Kind of borderline frantic.
Yeah.
And they have a funny, they like that yowl that they do.
Yeah. Their eyes just like are like, ah. Same.
Yeah, right. Me, when I have an internal medicine case that's gone awry, just slightly panicked. So anyway, they're relatively straightforward cases. I actually really love getting a hyperthyroid diagnosis because I know exactly what I'm dealing with. I know exactly how to manage it, and I know that these cats end up doing pretty well.
Yep. And then we kind of talked about a gray zone with the hypothyroid where you send off the free T4. There's a gray zone in cats too. I believe it's 2.5 to 4 or
especially
4.4.
in old cats.
Yeah.
Because your older cats should be closer to 1, high 1s, maybe a low 2.
Yeah.
So if you've got like a 3.8 and it's like a 14-year-old cat and they're clinical, then
you maybe will send out that free T4 by equilibrium dialysis and see if it's abnormal there. And if it is, then you can proceed with treatment. I've had a couple internal med specialists that I've talked to when I've had cats who are just like borderline high on their, they're in the gray zone with their total T4, borderline high on their free equilibrium, and like mildly clinical, so like a vomit once every like 3 weeks. I've had some internal med specialists be like, just check them again in 2 months or a month, and like if they're creeping up, then start treatment, but don't jump to it right away.
Yeah, I went to a CE. Yeah, there was a CE I went to an endocrinologist, and her own cat was the same way. And she said, I checked her every now and again. It took her about almost 2 years before she was officially hyperthyroid.
Yeah, and they're like, obviously, like, if they become clinical, like, this is a problem. They're losing weight, start treatment. But if it's an occasional
don't treat the test.
Yeah, exactly.
Yeah, because cats will vomit for a myriad of reasons, like food intolerance, hairballs, stress, because they're a cat. They just, so you can't use that alone.
Yeah.
The last thing I think I wanted to say about hyperthyroidism is what we do know about risk factors. I think it's really interesting. For starters, we see it almost exclusively in indoor cats, but that may just be because only indoor cats are getting checked and evaluated or living long enough to develop hyperthyroidism. But it is proven that cats that eat wet food from the pop-topped canned foods are 5 times more likely to develop hyperthyroidism. Now, my cat never had canned food in his life. He didn't like it. He didn't want it. I wasn't going to deal with it. And so he ate dry food. And so 25% of cats with hyperthyroidism are strictly on dry food. So we don't really know what else is going on there. But it is worth saying that we do believe diet plays a role in it. We do believe that there's a strong correlation with the pop-top canned foods and increased incidence of hyperthyroidism. So, and they're always old cats. I mean, you don't really see this in young cats.
No.
So,
I think the youngest I've had is maybe 8 or 9.
Yeah, I agree. I don't think I've seen one before 8.
No.
And usually they're 10, 11, 12, 14.
Here's a tale. It's a weird case, but it was like I was a year out from school. This is a dog with hyperthyroidism. It was a year out from school, and I walked into a room, and the dog was just like leaping on me, and its eyes were like bugged out, like we were talking about the cats who are hyperthyroid.
Yeah.
It was just frantic, and it was so skinny, and I was just like, and it was dropping hair, and I was just like, what? And cats will get something called a thyroid slip, which is where their thyroid is bigger, and you just run your fingers over their neck, and you can kind of feel it slip between your fingers.
Yeah, sliding in there.
And I did it on the dog, and I went, oh my gosh. I went, oh no. And so I was like, can I do a thyroid test? And so she was like, yeah, he's been losing weight for a long time. I was like, okay. Run and did it like 20 or 15. And I was like, what?
Where's the textbook?
Yeah. And I was like, well, sadly, there's only one reason why this is happening.
And he was so young too, right?
Yeah. He was like 5. And so I went to her, and I was like, here's a Weimaraner. Which they're...
Weimaraner?
Guys. I can't. Say it again.
Weimaraner?
If you bring one of those...
Weimaraner. No, there's no rhyming. It's rhyming like a watermelon. Weimaraner.
If you bring one of those W dogs here, I'm not going to say the breed.
Aren't you a pretty kid?
Yeah, you're so cute. And so he was already, because they're pretty frantic, but it was like another level. And I sadly had to go in there and talk to Mom. And I actually aspirated the
I was going to say, I thought you did. Confirmed it with cytology.
And I confirmed it with cytology, and then we referred to oncology.
To see if they could remove that. Because that would be a time where surgical removal would be warranted.
They definitely go and remove those.
Yeah, so I've definitely had some cats with thyroid carcinomas, but I personally have not had a dog.
Yeah.
It's so interesting.
I've had 2, because I had one here, and it's interesting because with thyroid carcinoma in dogs, most of the time they don't produce the thyroid hormone, so a lot of times they're not hyperthyroid. But the first one I had was. The most recent one was not producing.
Yeah.
And that was a thyroid carcinoma confirmed by cytology.
Yeah, and then you have the parathyroid, which, that's a whole nother...
Calcium changes.
Mm-hmm. With tiny little dot at the bottom of the exclamation point is the way I think of the parathyroid gland.
I've had one.
Yeah, those are surgical recommendation if you get a hyperparathyroidism case, because it's usually neoplastic.
Yep.
So anyway, there's a crash course on the thyroid.
Mm-hmm.
Yay. You guys feel educated? I feel somewhat overwhelmed myself. And slightly impressed at the amount of information we just store up in our little noggins at any given time. Okay, cool. So if you have any questions, if you think your pet might have a thyroid condition, give us a holler. We'll sort it out for you. It's nothing to it. Really, it's a snap.
It's a very easy test for us to run.
It actually is. To rule it in or out, and then, if we have to pursue that further, we obviously can.
Yeah.
So.
Thyroid or chubby dog.
Yeah.
It's like a game show.
Yeah, absolutely. Next time we'll talk about the adrenal gland.
Yes.
Bum, bum, bum.
Ugh.
That's a doozy. The thyroid starts to look like your like sweet little cousin compared to the like, I don't know what the analogy end of that would be, but like some evil, scary lurking.
The adrenal's mean.
The adrenal is mean. It's like the progression through the Harry Potter books. Like the adrenal gland is like books.
Deathly Hallows.
Yes. And what's the first one?
Sorcerer's Stone.
Okay, there's your thyroid for you. So
it's just like childlike. Easy.
Yes. Yeah.
No one's necessarily gonna die.
Yeah. Exactly.
There's
still a Horcrux, but you
get to the 8th book and
it's getting scary.
All
right, that's enough from us. We're gonna quit prattling, and you guys have a great rest of your day. Thanks for sticking with us. Bye.